I remember one weekend shift I was working in the emergency department and had a patient come in who was in respiratory distress. And as it turns out, he was having car trouble and was unable to reach his dialysis center for the entire week. And so he came in very volume overloaded. Having a care plan that addressed his transportation needs for discharge was going to be key in preventing readmission rates and help him prevent complications from his ongoing medical condition.
Social determinants of health are the conditions in which we live, work, and play. This can include things like access to transportation, healthy food, having housing. And while you're admitted to the hospital, we may be asking you to complete a brief survey to tell us about what your needs might be.
Understanding a patient's social and environmental circumstances can help a medical provider to better understand some of the root of the causes or contributing factors to illness. These factors can impact up to 80% of a patient's health outcome, while the medical care they receive accounts for 20%.
Currently, social workers screen all patients that they see for consults during the intake, regardless of individual circumstances. In the near future, all patients will have the ability to complete a screening in the privacy of their hospital room using their companion tablets.
What it addresses is 5 basic pillars, and that is food insecurity, housing instability, utilities, interpersonal safety, and transportation needs.
Showing empathy and compassion to a patient's unique needs can help patients and their providers make a more realistic plan together, ultimately improving their health outcome.
Helping to manage the patient's acute medical condition is the easy part. Making sure that their social needs are being addressed in order to prevent additional complications or recurrences is key in helping them long term.
So if you're not able to understand the treatment that's given, if you're not able to financially afford the medication that's given, if you're not able to travel to the doctor's office with ease, that will impact whether or not you go, take the medication properly, or even take the medication at all.
Everybody deserves a chance to live a healthy life, and some patients need more help than others to achieve that.
There was a young mother with 2 young children who gave birth at Valley. She was homeless and had been involved in a domestic violence situation. And the interdisciplinary team, consisting of Valley social worker, nurse, and physician, connected her with community resources to establish subsidized housing, furniture, education, and daycare for her kids, and nutritional programs.
Primarily as a physician, we're educators, and we're trying to have our patients partner with us and have them be in a position where they can advocate for themselves in terms of what their health needs may be.
Our goal is always to jump in and help anyone and everyone wherever their needs are. So it's super important to just start the conversation, listen, and be able to help wherever they can, because that's kind of why we all got into healthcare to start with.
We're committed to ongoing education for our staff, and this includes training modules on the relationship between social determinants of health and health outcomes, sensitive questioning techniques, and collaboration with community partners to ensure that staff are well equipped to support patients effectively. In your discharge paperwork, you'll find information about the Valley Cares website, which has a list of local community resources for various social determinants of health needs. Trust that the Valley team is here to help you and to serve. We're here to meet you where you are, and if you express needs to us, we're going to do our very best to do everything we can to connect you with services.